If you're over 60 and waking up multiple times during the night, you're not alone. Up to 50% of seniors experience this. But it's not just a normal part of aging you have to accept. There are natural, science-backed strategies that can help you sleep through the night again without relying on sleeping pills. As we age, our bodies produce less melatonin, the hormone that regulates our sleep-wake cycle. We spend less time in deep sleep and more time in lighter stages, making us more susceptible to disturbances. Combined with medications, chronic pain, an overactive bladder, and circadian rhythm changes, it creates a perfect storm for disrupted sleep. Here's what you can do about it naturally. Your circadian rhythm is like a conductor orchestrating when you feel alert and when you feel sleepy, and it's foundational to good sleep. The most powerful tool you have is light exposure. Get bright light, especially natural sunlight, within an hour of waking for at least 15 to 30 minutes. This anchors your circadian rhythm. If you can't get outside, sit near a bright window or consider using a light therapy box rated at 10,000 lux. Evening light exposure plays a major role in sleep. As the sun sets, your brain should increase melatonin, but artificial light, especially blue light from screens, disrupts this process. Dim your home lighting after sunset and use night mode or blue light blocking glasses if you use screens in the evening. This small adjustment can significantly improve how easily you fall and stay asleep. Nocturia, or nighttime urination, affects up to 80% of older adults. The solution is smart, fluid timing, not dehydration. Drink enough during the day, then reduce fluids 2 to 3 hours before bed. Avoid caffeine after 2 p.m. and limit evening alcohol, as both increase urine production. If you take diuretics, ask your doctor whether morning dosing is possible. Empty your bladder completely before bed. A technique called double voiding can help. Urinate once, wait a moment, then try again. This ensures your bladder is as empty as possible. If you do need to get up at night, keep the path to the bathroom clear and use dim night lights rather than bright overhead lights, which can fully wake you up and suppress melatonin. Temperature plays a major role in sleep quality. Your body needs to cool down to fall asleep, so keep your bedroom cool, ideally between 60 and 67 degrees Fahrenheit, adjusting as needed. A warm bath or shower about 90 minutes before bed can help by triggering a post-bath temperature drop. Use breathable, moisture-wicking sheets if you overheat, and keep your hands or feet warm with socks if that helps you relax. What and when you eat also affects sleep. Large meals within 2 to 3 hours of bedtime can cause discomfort or acid reflux that disrupts sleep. If you need a snack, keep it light and balanced, pairing complex carbs with a little protein, such as whole grain crackers with cheese or a banana with a few almonds. Certain foods can actually promote better sleep. Foods rich in magnesium, like leafy greens, nuts, seeds, and whole grains, help relax muscles and calm the nervous system. Tryptophan-containing foods, like turkey, eggs, and dairy, can support melatonin production. Tart cherry juice is one of the few natural sources of melatonin and has shown promise in studies for improving sleep duration and quality. On the flip side, avoid anything spicy, acidic, or high in sugar close to bedtime. And while alcohol might make you drowsy initially, it disrupts sleep architecture and often causes middle-of-the-night awakenings. Physical activity is perhaps the most underutilized sleep aid available to seniors. Regular exercise has been shown to increase total sleep time, improve sleep quality, and reduce the time it takes to fall asleep. But timing matters. Morning or afternoon exercise is ideal, as it raises your body temperature and alertness. Exercise too close to bedtime can be stimulating. You don't need intense workouts. Studies show that even moderate activities like walking, swimming, tai chi, or gentle yoga can significantly improve sleep. Aim for at least 30 minutes of moderate activity most days of the week. The key is consistency. Now, let's address the mental and emotional side of nighttime awakenings. because anxiety about sleep itself often becomes the problem. If you wake up and immediately start worrying about how many hours you have left to sleep, you've activated your stress response. Instead, practice acceptance. When you wake up, don't look at the clock. Checking the time only creates anxiety. Keep your eyes closed, breathe slowly, and try a relaxation technique like progressive muscle relaxation. If you're still awake after 20 minutes, get out of bed. This is crucial. You want your brain to associate your bed with sleep, not with frustration and wakefulness. Go to another room with dim lighting and do something quiet and non-stimulating. Read a boring book, do some gentle stretches, or listen to calming music. Only return to bed when you feel genuinely sleepy. Establishing a consistent wind-down routine is one of the most powerful sleep tools available. Your brain loves patterns and rituals. When you do the same calming activities in the same order every night, you create a psychological trigger that tells your body it's time to sleep. Your routine might include dimming the lights, taking a warm bath, doing some light stretching, reading for 20 minutes, and practicing a few minutes of deep breathing or meditation. Start your routine at the same time every night, and try to keep your bedtime and wake time consistent, even on weekends. This regularity strengthens your circadian rhythm. Breathing techniques can be particularly helpful when you wake during the night. Try the 4-7-8 breathing method. Inhale quietly through your nose for 4 counts, hold your breath for 7 counts, then exhale completely through your mouth for 8 counts. This activates your parasympathetic nervous system, which promotes relaxation and sleep. Repeat this cycle 4 times. Another effective technique is body scan meditation, where you bring awareness to each part of your body from your toes upward, noticing any tension and consciously relaxing it. Your bedroom environment deserves attention too. Think of it as a sleep sanctuary. Keep it dark, with blackout curtains or an eye mask. Even small amounts of light can interfere with melatonin production. Minimize noise with earplugs, a fan, or a white noise machine. Remove the television, computer, and other electronic devices that emit light. Invest in a comfortable, supportive mattress and pillows appropriate for your sleeping position. As we age, we may need more support for joints and pressure points. Use breathable fabrics like cotton or bamboo for better temperature regulation. Certain natural supplements may help, though you should always consult your doctor before starting anything new, especially if you're on medications. Magnesium glycinate, taken about 30 minutes before bed, can promote relaxation and improve sleep quality. Melatonin can be effective, but timing and dosage matter. For older adults, less is often more. Start with a low dose, 0.5 to 1 milligram, taken about 1 to 2 hours before bedtime. Taking too much or at the wrong time can actually disrupt your natural rhythm. Other supplements with research support include valerian root, passion flower, and L-theanine. Chronic pain is a major sleep disruptor for seniors. Arthritis, back pain, and similar conditions can cause frequent awakenings if not properly managed. Gentle evening stretches, heat or cold therapy, and supportive sleep positions can help reduce discomfort. Side sleepers may benefit from a pillow between the knees, while back sleepers often sleep better with a small pillow under the knees. If you use pain medication, ask your doctor about the best timing, as some work better when taken before bed. Stress and worry also steal sleep. Many seniors lie awake thinking about health, family, or finances. Practice stress reduction during the day through meditation, journaling, or talking with someone you trust. Keep a notepad by your bed for a quick worry dump if your mind races at night. Then remind yourself you'll handle those thoughts in the morning. Certain medications can interfere with sleep, including beta blockers, corticosteroids, some antidepressants, and decongestants. Review all medications and supplements with your doctor or pharmacist. Sometimes adjusting timing or switching options can improve sleep without affecting your health. Never stop medication on your own, but do speak up if you suspect a problem. Sleep disorders also become more common with age. Sleep apnea causes repeated breathing interruptions and frequent awakenings, while restless leg syndrome creates an urge to move the legs at night. Both are treatable, and addressing them can dramatically improve sleep quality. Mindset matters. Poor sleep is not an inevitable part of aging. Treat better sleep as a priority and be patient while testing different strategies. Track what you try, give changes at least a week or two, and celebrate small improvements. The goal isn't perfect sleep, but enough restorative rest to support your health, mood, and daily energy. Start with 1 or 2 small changes tonight. Consistent, simple adjustments add up, and with the right approach, you can take back control of your sleep.